Everyone, this is Dr. Swetha from Telangana. Actually, I'm today demonstrating about the probes. Ultrasound, as you all know, they have a linear, curvilinear and vaginal probes. Today I will be demonstrating on the vaginal probe. So the correct way of holding this vaginal probe is with the marker up, and the barriers has to be kept at least 1 or 2 barriers. The prerequisite for using this vaginal probe is to empty the bladder, and it has very thin crystal, and this determines the frequency of the probe. The frequency of this probe is 5 to 6 megahertz, which means it has high frequency, but with less penetration. The clarity of the image is very good and the resolution is better. We can visualize the uterus, the adnexa, we can do the day 2 scans, follicular studies, and even used in ovum pickup. What more? And this has 2D and 3D. This is another probe. This is 3D probe. It is used in doing sono AVC and all. It has many advantages. It's like a stethoscope for us gynecologists, so everyone has to use this. That's all, ma'am. Thank you for the patient hearing.
Ma'am, hello, I'm Dr. Rakhi. Ma'am, what is the major difference between 3D and 2D probe? Like, can we use, is there any situation in which 2D can help us instead of 3D?
This is mainly used for the diagnosis of any pathology, but 3D helps us in confirmation of the diagnosis from the 2D.
So 3D is always superior to...
yeah, just in confirmation, but everything can be performed with 2D also.
Okay, thank you.
Like 3D is very good to diagnose the malaria.
Yeah, malaria.
It is the coronal view.
We get the coronal view from the 3D. The sagittal and the axial views, they can be better seen in 2D.
We can get everything from 3D. What we
Mullerian anomalies basically.
2D we can do with 3D. In addition to the coronal.
2D is generalized, 3D is more specialized, specifically when we're looking for
the clarity. Even uterine anomalies or fibers are beautiful.
Yeah, depending on the days of the menstrual cycle, one can diagnose the polyps.
Anatomical volume.
Yes.
in Achampeta, it's very good to go for 3D and all. Volumetric.
3D is volumetric probe.
Yes.
And 2D is B mode.
B mode.
2D.
Okay.
It should be gray skin.
Okay.
But for to calculate volumes, to calculate, look at the features, proper morphology, irrespective of any part of the cycle. 3D is more.
Okay.
To diagnose Mullerian anomaly, which 3D probe is better, TVS or transabdominal?
I think it's TVS only, ma'am.
Transabdominal only for mainly for fetal. So one more question I would like to ask.
Yes, yes,
May I
ma'am.
answer? So ma'am, sometimes.
You will take your name first.
Hi, I am Dr. Reena Bansal from Nabha, Patiala, Punjab. So I would like to ask, which generally we see on the reports, like right and left ovaries is always confused on the TVS. Sometimes when we open the abdomen, ectopic pregnancy is on the right side, but on the ultrasound report it is mentioned it is left side. So how do you remove that confusion?
So actually I already told you that the marker has to be put up if you wanted to, and if it is, when it is up, looking upwards, and if we see the uterus in the sagittal section, just turn it 90 degrees, then we can visualize it in the axial section. So when it is in the axial section, the one lying on right of the right of the ovary is right of the uterus is right ovary, and the one on the left is left ovary, ma'am.
And in addition to that, whatever is on the side of the bladder will be anterior, and whatever is away from bladder
That would be
towards the bladder is always anterior, away from it is posterior.